So the continuation part. So these are the layers of retina. Okay, we said that this one is the epithelium that we discussed, that is about 50 to 90 micrometer. Next we have the Bowman's membrane, that also we discussed, that is where we said that where if there is any trauma happens to this Bowman's membrane, it leads to corneal opacity and loss of vision. Okay, so that is the epithelial basement membrane. Okay, next we have the stroma. Okay, it is like a big layer. Okay, before that we should talk about the corneal opacities. Other layers are also there. After studying I will explain. So the corneal opacities, there are three types of corneal opacities is there: nebular, that is faint, and macular, which is more dense, and leucomatous, that is leucomatous element. Leucomatous, that is the densest. Okay, so nebular means there is a faint, like corneal opacity is there but it is faint, and macular means it is more dense, and leucomatous means it is the densest. Okay, so these are the three types, and we should know that is that two properties, that is pupillary margin and iris details. Pupillary margin, that is a macroscopic finding, and iris details are like microscopic findings. Okay, so the macroscopic finding, pupillary margin, can be seen on both nebular and macular, that is more dense, but in leucomatous, that is the densest corneal opacity, here the pupillary margin is not seen. Okay, next about the microscopic finding, that is the iris details. Iris details means here the structure of the iris, small depressions, elevations of the iris, that can be seen only through the microscope only. So, and that can be seen only in case of nebula, that is the faint corneal opacities. In the macular and leucomatous, it cannot be seen. Okay, so I will ask a question: which type of corneal opacity shows maximum distortion of vision? So you will be saying maximum distortion means it will be leucomatous because it is only densest, but it is not, because in leucomatous there is complete vision loss is there. Okay, hence means complete vision loss is there, means there is no maximum distortion of vision is not happening. It is like complete vision loss. Distortion means when the light enters, there is diffraction of light and distortion of vision should happen. That is mainly happens in the nebular. Okay, nebular or macular, because here still the vision is present. Okay, in nebular and macular still the vision is present. Okay, means completely it is not opaque. Okay, some portions there the light will allow the passage of the light. Okay, that allows the passage of light. So what happens, this light will undergoes maximum diffraction and maximum distortion of vision occurs in case of nebular and macular, not in leucomatous, because in leucomatous what happens, here the light can't go inside, because there is no diffraction of light or there is no distortion of vision occurs. Here complete vision loss is happening in leucomatous. So the answer for this question, which type of corneal opacity causes maximum distortion of vision, that is the maybe nebular or macular. The appropriate answer will be nebular only. Okay, so the third layer we are saying about the stroma. Okay, this layer, that is the stroma, that is the thickest corneal layer. We can see that is ഏറ്റവും thickest ആണ്. The space we look at, it is the thickest corneal layer, and it comprised of collagen fibers, most commonly type 1 collagen fibers, and some glycosaminoglycans, GGs. The most common glycosaminoglycans is keratin sulfate. Okay, and these glycosaminoglycans are present in between collagen. So it is a mixture of collagen and this glycosaminoglycans. Okay, next is the Duval's layer. Okay, fourth layer is the Duval's layer, fifth layer is the Descemet's membrane, and sixth layer is the posterior, that is innermost layer of cornea. So in this picture we can see this is the Duval's layer, and in between we have the Descemet's membrane and thus endothelium, that is the posterior most layer. Okay, so we are discussing next the Duval's layer, that is the pre-Descemet's membrane, and that is the strongest corneal layer. So if anyone asks which is the strongest corneal layer, we should say that is the pre-Descemet's membrane, that is the Duval's layer. This is the Descemet's membrane. Descemet's membrane, it is secreted continuously, that is throughout the life, by the underlying endothelial cells. Okay, so there is some endothelial cells are there, and this endothelial cells, I think that is the sixth layer, that is the posterior innermost layer, that is endothelium. So these endothelial cells are continuously or throughout the life they are secreting what the Descemet's membrane. Okay, so what is the property? Descemet's membrane can regenerate. Okay, Descemet's membrane can regenerate. That's it. And there is a peripheral termination of this Descemet's membrane near the anterior portion of the trabecular meshwork is known as Schwab's line. Just study that, can be asked as a MCQ. What is the peripheral termination of this Descemet's membrane near the anterior portion of the trabecular meshwork is known as the Schwab's line. Okay, next is the posterior or the innermost layer of the cornea. So the posterior or the innermost layer of the cornea is the endothelium, and the endothelium has two functions. First one is it is metabolically most active layer. It is the metabolically most active layer, and it helps to maintain the corneal transparency. Corneal transparency maintains and സഹായിക്കുന്നതും എവരാണ്. So first function is it is a metabolically most active layer, and second is it helps to maintain the corneal transparency. How means by tight junctions between the endothelial cells by not allowing the aqueous humor to enter into the cornea. So we know that this one is the corneal side, okay, and here is the anterior chamber which contains the aqueous. So here these endothelial cells are arranged by tight junctions. There is no space between these cells. So since these are arranged by tight junctions, what means it will not allow the aqueous to enter into the cornea. What happens if this aqueous fluid enter into the cornea? It will lead to haziness. So it will help in maintaining the corneal transparency. If the cornea becomes haziness by entering this aqueous fluid, it will affect our vision. The transparency of the corneal means light cannot pass through it. Okay, so it helps to maintain the corneal transparency. So the endothelial cells with tight junctions. Here there is tight junction. The aqueous humor can't enter through it to the cornea, but whenever there is an injury, എന്തെങ്കിലും ഒരു injury ഉണ്ടാകുമ്പോൾ it enters and leads to corneal edema. So whenever there is an injury occurs to this layer, what happens? This this aqueous will enter into the cornea, and this leads to corneal edema. That is, haziness will increase and the transparency will be lost. Okay. So another question, that is, what is a normal corneal endothelial cell count? There is a normal corneal endothelial cell count is there, that is about 2400 to 3000 cells per millimeter cube. And what if the cells are less than 2400 per millimeter square but greater than or equal to 500 cells per millimeter square? So what happens? അതായത് normal it is 2400 to 3000. So what if cells are less than 2400 but greater than 500? Then the cornea compensates by polymegathism and polymorphism. That is, so if the normal endothelial cell count is this much. So here the cell is decreased only. So what mechanism? The cornea will compensate by doing polymegathism and polymorphism. Polymegathism means they will increase the size of this endothelial cells, or they will change in shape. Okay, they will change in shape so that they can plug in the gap created by the lost cells. Okay, so we know that some of the cells are lost, so there is some spaces there. So the space can be plugged in by changing the size and shape of these endothelial cells. Thus they can maintain the integrity of the tight junction of the endothelial barrier. Okay, so that is if the cells are between 2400 to 500. So if what happens if the cells are less than 500? So if the cells are less than 500, that is the threshold. Okay, that is the threshold. Then the cornea cannot compensate, and this corneal decompensation leads to hazy cornea, and this leads to the loss of transparency. So if the cells are less than 500, that is the threshold, then the cornea cannot compensate. Then the decompensation leads, that is, the cornea cannot compensate and decompensation, and thus what happens? This fluid will enter into the cornea, hazy cornea occurs, and the transparency will be lost. So there are some investigations for counting the corneal endothelial cell. Okay, that is by the specular microscopy. So what specular microscopy means? Here we know that we can't take it and look. Okay, we use here to penetrate all the layers and give the count. So we know that we cannot take the endothelial cells and count it. Okay, it's not possible in case of endothelial cell. So here what we are doing means, here we are penetrating all the layers. Okay, we are penetrating all the corneal layers and we are giving the count, that is by the specular microscopy. So the normal endothelial cells, how they are arranged, they are hexagonally arranged. Okay, and the extended use of this contact lens is the reason for this corneal decompensation seen as a whole in the microscopy. So while we are looking through the microscopy, we can find out the endothelial cell count, and if there is any disfiguration, we can found out through this specular microscopy. And a common reason is an extended use of contact lens. Okay, so we are using most of them are using contact lens now. So the extended use of this contact lens is the main reason for this corneal decompensation, and we can see as a whole in this cornea through this microscopy. Okay, so that's it about the cornea. Next is the sclera. Sclera anatomy, that is, we know that it is a posterior 5/6 of the outermost layer is the sclera, and which is white in color and opaque. Okay, we know that the cornea is only transparent. The sclera, that is white in color and opaque, it is like an irregularly arranged collagen fibers are seen in the sclera layer, and the thickness of sclera is variable. Means not like all, like throughout the layer it is not like uniform thickness. It is not having uniform thickness. The thickness is variable, that is the posterior to the insertion of recti muscle, this is recti muscle, and posterior to the insertion of the recti muscle, that is the thinnest. Here it is the thinness, and where it is thickness, okay, around the optic nerve the sclera is thickest. So it is variable only, and its sclerocorneal junction or limbus, it is about 0.83 millimeters. So the thickness of the sclera is variable. Okay, there's the layers of sclera here like 3, not like more number of layers are there, only 3 layers are there. First one is episclera, then sclera proper, then lamina, fusa. Okay, here the episclera, that is outermost layer, and this episclera, the outermost layer, that is highly vascular. So if something like got stuck there, it is highly vascular, so bleeding will be there. Okay, and this it merges with Tenon's capsule, that is around 3 millimeter posterior to the limbus. Okay, so what is episclera? It is outermost layer and it is highly vascular, and it merges with a capsule, that is the Tenon's capsule, that is where around 3 millimeter posterior to the limbus. Okay, posterior to the limbus, 3 millimeter posterior to the limbus side, it is merging to the Tenon's capsule. And 2 blood vessels are there. Superficial blood vessels and deeper blood vessels are also there. Here the superficial blood vessels means it is near the episclera. Okay, superficial blood vessels are near the episclera, and the deeper blood vessels are almost near to the sclera proper. Okay, so 2 blood vessels are there. One is near the episclera and one is near the sclera proper. Sclera proper, it is normally it is avascular. So episclera is vascular, it is and the sclera proper is avascular, and it is made up of collagen fibers, that is regularly arranged. And lamina fusca is the third layer, that is the innermost layer. That's it. So 2 pathologies are associated with this sclera, that is first one is episcleritis and scleritis. So episcleritis means inflammation of the superficial blood vessels. Okay, so we can see it is redness seen on the sclera part, and on inflammation